Hi and welcome to the Global Education Group's CME video blog, where we address emerging hot topics in the CME enterprise. Today we're going to talk a little bit about needs assessments, professional practice gaps, and how to develop education that addresses knowledge, competency, performance, and patient outcomes per the ACCME's recommendations. Now, this information today was developed not only from Global's clinical team and professional education staff, but also from the recent ACCME Bridge to Quality workshop held in Chicago. So when we talk about professional practice gaps, that's really where we start. But it's important to note that the gap analysis that you do is actually part of the needs assessment. And so where we start is with the gap. And the gap really is nothing more than the difference between what's currently being done in the field and what should be done in the field. So sort of current practices and either better or best practices. And the point of the education is to bridge that gap and get people to move along from their current practices or knowledge or performance, etc., to better performance or knowledge. And so we start by asking a simple question, and that is, what is the problem in the medical field? And so that could be a problem of diagnosis. Is there not enough diagnosis happening or improper diagnosis? Could be dealing with referral or treatment. Could be even dealing with the delivery of healthcare. Or a little bit outside of daily practice, it might be dealing with leadership issues or an issue that kind of cuts across every discipline, but especially in the medical field, communication. So we're looking to say, what is the problem? Is it a problem of communication, diagnosis, treatment, whatever? And then that leads us to the next question of basically, why does this problem exist? And so when we answer, why does the problem exist, we're basically going to get to, is this education going to address knowledge, competency, performance, or patient outcomes? So dealing with education that addresses knowledge, basically, if we answer the question, why does this problem exist, and we come to the answer that physicians, let's take an example, an area of alcohol abuse. So in the area of alcohol abuse, if we say, well, why is there a problem out there? We might say, well, physicians should know that patients would address or be more likely to seek treatment in their alcohol abuse if the physician would just simply speak to them about the problem. So if physicians knew that, then there would be a better result. Well, that's obviously an issue of knowledge. Let's talk about an example of competency. In competency, we may determine that physicians perhaps need strategies for talking to patients about their alcohol abuse and for helping them deal with it. Well, if physicians need strategies, if that's what we come to, then we're probably going to be developing education that addresses competency. For performance issues, we might come to the conclusion that physicians don't effectively communicate with their patients about alcohol abuse issues. And so therefore we want to develop education to help physicians effectively communicate, screen, and intervene with their patients. In that case, we're talking about a competency area. Lastly, when it comes to patient outcomes, we might conclude when we ask, hey, why does this problem exist? We might conclude that physicians need to reduce the risk or help lower levels of alcohol abuse. If that's the case, we're talking about a true patient outcome, and therefore we would want to be developing education around those areas. If you need help developing any needs assessment or professional practice gap, feel free to contact us at globaleducationgroup.com. We work with all of our partners in basically developing a template that helps them identify the professional practice gap, develop the needs assessment, and then really develop and address learning objectives in the education that targets competency, knowledge, performance, or patient outcomes. If we can be of any help, let us know. Otherwise, have a great day. I'm Stephen Lewis.